Breast augmentation procedures typically last approximately 1 to 2 hours. Prior to the start of your procedure, the treatment area will be thoroughly cleansed and an anaesthetic will be administered. Depending on the surgeon's preferences and the nature of the procedure, a local anaesthetic in combination with intravenous sedation or general anaesthesia will be used. There are 3 possible incision sites for breast enhancement operations. The peri-areola involves making an incision along the border of the areola beside the nipple. Alternatively, the transaxillary incision is made through the armpit. The most widely used approach is the inframammary incision, which is placed along the crease immediately below the breast. For the purposes of this video, this technique will be described in more detail. A single small incision is made underneath each breast. Using an instrument known as a retractor, the surgeon will open the incision in order to gain better access to the breast tissue below. Although the incision will be made as inconspicuously as possible, its length and appearance may vary depending on the type and size of implant and your body contours. The surgeon will carefully separate the breast tissue with a minimally invasive cautery device and a scalpel in order to reach the area of the breast in which the pocket will be formed. Using an instrument known as an elevator and their fingers, the surgeon will carefully create a pocket in which to place the breast implant. Breast implants can be placed in 2 general locations, known as submuscular and subglandular placement. Submuscular placement refers to an implant that is placed partially or completely beneath the pectoralis muscle against the chest wall. In contrast, subglandular placement refers to an implant that is placed beneath the breast tissue but above the pectoralis muscle. Your surgeon will help determine the implant placement that is best for you, depending on your physical characteristics and lifestyle. The surgeon will insert the implant into the pocket and visually inspect your breasts to ensure that they are symmetrical and balanced. They may adjust the pocket and position of the breast implant itself to ensure that the desired look is achieved. The incisions will be closed using sutures. The scars from the incisions will fade slowly over several months. As with any surgery, you may experience some pain and swelling after surgery. It is advised that you follow the post-operative pain advice given by your surgeon. The majority of the swelling will likely subside within a few days. However, some swelling may persist for several weeks. Your physician may place you in a special bra or compression garment to aid in the healing process. Compression garments provide support and comfort, minimize swelling, and help maintain the position of the implants. You will most likely be able to return to work within 3 to 7 days after your procedure. However, it is important that you avoid any strenuous activity and lifting for approximately 3 to 4 weeks. Doing so may delay healing and could damage the implants. You will be able to notice the final results from your procedure once the implants have settled and the swelling has subsided completely. Long-term risks associated with breast augmentation may include capsular contracture, which can result in the hardening of the breast or deformation of the implant. Other risks include implant rupture, changes to nipple sensation, and infection. Your surgeon should inform you of all the associated risks, and if after surgery you experience symptoms such as excessive pain, a burning sensation, lumps, or aching, it is advisable to seek expert medical advice. It is important to realise that your breasts will continue to change shape over time. However, the results from breast augmentation are typically long-lasting, which means that your breasts will maintain the fuller, shapelier appearance that you desire for years to come.